Hello, my name is Ola. Our group today will talk about control infection. Control infection have some standards, so I will start with the spread of infection. Three components are very important to get infection. At the first, we have the source or reservoir, which comes from living organism like people or non-living organism like contaminated medical equipment. Next, we have mode of transmission, which is a three type. Contact, which come in direct or indirect. Direct like touch, sneezing or cough. Indirect, which the most frequent mode of transmission, and the transfer of pathogen through contaminated intermediate person or object. Droplet transmission or respiratory droplet. Respiratory droplets are generated when the individual discharges large contaminated liquid droplet into the air by coughing or sneezing or talking, usually less than or equal to 3 feet through the air, and also generated during a procedure such as bronchoscopy and cough induction. Airborne transmission, which is the spread airborne droplet in nucleus and can remain in the air for long period. Also can travel farther distance than the droplet. Have a special air handling ventilation, and respiratory prevention is required to prevent airborne transmission. At the end, we have the host or target of infection. Always people with low immune system have a larger chance to take infection than the people have good immune system. Also, patient with long-time therapy like chemotherapy patient or diabetes patient.
Hi, my name is Nuran. Today I will talk about hand hygiene. Hand hygiene is a way of cleaning one hand that substantially reduces potential pathogen, harmful microorganism on the hands. Also, the hand hygiene it's considered to be a primary measure for reducing risk of transmitting infection among the patient and healthcare personnel. When we do hand hygiene, it's a good idea to remove all our jewelry before washing our hands. First, wet your hand with water. Apply enough swab to cover your hand. Rub your hand together. Use one hand to rub the palm of the other hand and clean in between the fingers. Rub your hand together and clean in between your fingers. Scrape the fingers of each hand together and the palm of your fingers against the palm of your other hand. Rub one thumb using your other hand. Do the same with the other thumb. Rub the tip of your fingers on the palm of your other hand. Rinse your hand with water. Use the towel. With the towel, turn off the tap.
Hi, my name is Farah Zaid. Today I'm gonna talk about the standard precautions. First, what is the standard precautions? The standard precautions are infectious control guidelines and that we used in hospital to reduce the spread of pathogens between patient and health worker. By adhering to these guidelines, health worker professionals can help protect themselves and their patient and general public from spread of infectious disease. The standard precautions include hand hygiene and personal protective equipment, which is called PPE, and patient care equipment, and needle stick and sharp injury preventions, also the patient placement. First, the hand hygiene. The hand hygiene is very important for the healthcare worker, and they must clean their hand before and after every patient's interactions. as well as after any contact with the blood or body fluid or contaminated surface. Also, should use alcohol-based product for routine hand hygiene. Also, the PPE, which is mean the personal protective equipment, and this include the mask and the gown and the gloves and the face shields and eye protections. Must use PPE for each healthcare worker if there is close contact with patients or when they performing any procedure that could expose to blood or body fluid from the patient. The face mask is an important because the mucous membrane of the eye, nose and mouth are particularly vulnerable to some type of pathogens. That's why it's very important. The patient care equipment must be cleaned and disinfected between patients to prevent spread of infections, and if there is disposable equipment should be throw it after it will use. About the needle stick and sharp preventions injury, all the healthcare workers should be cautious when handling needles and other sharp objects to prevent accidental injury. Also, the patient placement. In some cases, the patient with certain infectious disease may need to be isolated in a private room to prevent the spread of infection. In the second part, I'm going to talk about the transmission-based precautions that used in the hospital for patients with known or suspected infections that require control measures to prevent from spreading. First type is contact precautions. In contact precautions, it's used in addition to standard precautions. First, we perform the hand hygiene and put gown and gloves before entering the room. Then we remove the gloves and gowns before leaving the patient room. Then perform the hand hygiene. Then we have the droplet precautions. First, the hand hygiene and wear surgical mask and face shield or goggles. Ensure the mouth, nose, eyes are protected. Then we will try as possible to limit the transport of patient and put him in private room. For airborne precautions, first we will do the hand hygiene and wear fit tested N95 mask. Then we put the patient in private negative pressure room with the door remain closed. Then wear the gown and gloves before entering the patient room and remove it after go outside the patient room.
Hello, I'm Noran. I'm going to talk about procedures to minimize infection with nebulizer. And large volume nebulizer and mist tint. Always fill nebulizer reservoir with sterile water and fill fluid reservoir immediately before use. Also, don't use large volume room air humidifier that create aerosol. Use mist tint and their nebulizer and reservoir that have undergone. Now I'm gonna talk about small volume nebulizer between treatment on the same patient. Clean, rinse with still water and air dry. Don't share small volume nebulizer between patient without performing sterilization. Use only sterile fluid or nebulization and dispense this fluid aesthetically. Use only sterile fluid for nebulization. Procedures to minimize infection risk with oxygen therapy. Humidifier are not needed with the flow. When needed and whenever possible, sterile disposable humidifiers should be used. And with residual humidifier, fluid reservoirs should be filled immediately. Fluid must not be added to replenish partially filled reservoir. Now I'm going to talk about procedures to minimize infection risk with mechanical ventilator. Don't routinely change the ventilator. Sterilize or high-level defecant. Wash hands after drying bacteria. Use sterile water to fill bubble humidifier.